we've already started to see very promising impact, I would say, from the use of clinical AI tools, health AI tools. And I might broaden it to say health AI tools, because ultimately, what we're seeking with any of these tools and just generally with the work we do is to promote, the health of our patients, of our communities, of our organizations, of our clinicians. And so in the health AI space, I'll say one of the anchor use cases, which I imagine many quote to you, is the ambient intelligence and earlier on ambient documentation. And we'll say in the beginning of 2025, our group published one of the earlier papers in that space to show early impact of those reducing the amount of time spent in the chart. And then, I know many others, including now at randomized control, multi-organizational randomized control level, have demonstrated time savings as well as reductions in cognitive load in interacting with the EHR. Now, I'll say that those are early outcomes, and there's plenty more outcomes to be examined in association with which we're doing as well in association with the use of those tools. But it is very promising, and it's very interesting. I think it's very rare, if at all, that you see a single piece of technology that almost uniformly clinicians will say, and clinicians could be physicians or advanced practice providers, they could be nurses, they could be other members, will say, hey, I used this tool and it saved my career, or it saved my practice, or I'm going to practice longer because of this, or I feel unburdened at the end of the day. And that sense of unburdening, that sense of hope in clinical workflow, actually goes well beyond even the amount of time savings. So it's a very interesting space in terms of the impact of the early, I would say, again, very early impact of ambient intelligence. I think other areas where we're seeing impact, and I'll switch to, we tend to think of, like many, AI applied to patients, to clinicians, and to the administrative space, and shifting a bit to the health AI applied to the administrative space. We've been starting to see very, very promising early impact in areas such as being able to increase medication access for our patients, and being able to streamline processes such as prior authorization by being able to extract information from the chart, and then submit that information and interact with that information in service of processes like prior authorization. I would say even going beyond the current process of automating it, reimagining the whole as which we're working on as well. And one final use case I'll mention is around chart abstraction, which is a set of use cases that's very well suited, I think, for the capabilities of generative AI in terms of using generative AI to be able to review the chart and then be able to populate, let's say, chart abstraction forms in service of a variety of activities, namely quality reporting. And we've seen that the use of generative AI in these spaces can increase the accuracy of the information and allow us to save time on population of that type of information, which then is time back for our teams to be able to devote to other activities such as the actual sort of work of quality improvement on the ground, boots on the ground with our teams. I'll actually mention one other use case that I think we at Penn Medicine are particularly proud of, that is called Chart Hero. And Chart Hero is a tool that's been developed in conjunction with our Center for Healthcare Innovation and Transformation, as well as our Data and Technology Solutions organization, which I and many of our teams belong to. And you can think of this tool like ChatGPT for the electronic health record built internally. So it completely changes the game in the sense of interactions with the electronic health record, meaning one can query the electronic health record with a prompt similar to a prompt you might use in any one of the consumer AI tools, and say, hey, I'll give you one example for me. I'm prepping for my clinic visits, and I'll say, hey, summarize this patient's, why is this patient, summarize their history in the form of a table, let's say, and show me all the prior relevant cardiac testing. This would have taken 8, 10, 12, 20, 30 clicks around the EHR. And now with one prompt, I can have all of that information teed up for me, which of course then I'll go and confirm and use as an anchor. But it has revolutionized, I would say, in many ways, chart preparation, in addition to other generative AI-based summarization tools we have.